Just when people thought that the worst of the COVID-19 pandemic was behind them, it struck back with a vengeance. Maharashtra is leading the rather painful list of fresh COVID cases and deaths. As of 2nd April 2021, the state reported 47,827 cases and 202 deaths, by far the most for any state.
Namaste and welcome to New India Junction. This is Nivedita Tiwari.
As a fresh surge of cases is hitting the state, Maharashtra finds itself once again facing the wrath of the COVID pandemic. Pune, Mumbai, Nagpur, Amravati and many more cities have been struggling to keep up with the surge in cases of COVID this time around as well.
आपल्या राज्यामध्ये पुन्हा एकदा कोरोना मोठ्या राक्षसापेक्षा म्हणजे गेला राक्षस होता त्याच्या डबल टिबल दुप्पट तिपटीने अकराळ विक्राळ रूप धारण करून आलेला आहे. लॉकडाऊन करणार का हा प्रश्न अजूनही मी उत्तर देत नाही, पण साधारणतः आत्ताची परिस्थिती काय आहे ह्याची कल्पना आपल्याला देण्याची मला पुन्हा एकदा गरज वाटते. ही परिस्थिती फार चिंताजनक आहे.
माझ्या घरामध्ये कोण कामाला नाही, फक्त मी एकटीच कामाला होती. माझी मुलगी आहे, ती पण आता तिला पण तिच्या पोटात दुखत असल्यामुळे ती पण कामावरती जात नाहीये. आणि आता करोना परत असं ऐकलंय की लॉकडाऊन होणार आहे. तर लॉकडाऊन असं झालं तर काय करणार आम्ही?
With the state administration finding itself in a tough spot once again and the Chief Minister Uddhav Thackeray announcing strict restrictions and indicating a lockdown, we bring a lowdown on the COVID situation in Mumbai. Experts fear that the second round of COVID could cause serious economic impact, with the second wave raising fears of labour shortage in the country's leading industrial estate in the event of migrants rushing back to their hometowns. So what exactly is going on? Is this a second wave or just something akin to an aftershock? Experts seem divided on the same. While there seems to be a broader consensus on a second wave, some experts say they need more data to back this assertion.
Some experts also feel that the second wave is inevitable. However, its severity may be lesser than the last year's situation.
Dr. V. Ramasubramanian of Apollo Hospital, Chennai, in a seminar said that the impact may be milder because of younger population. Doctors in the state of Maharashtra, however, fear that the state government may be caught off guard once again, like the last time, unless the right measures are put in place on war footing.
See, initially Maharashtra did badly even during the first wave, and many of the other states followed. Some states did better because their contact tracing was better and they isolated better, and they are still following that protocol a lot better than what we are doing here. There have been issues with the people themselves because they've become too careless, and that has actually caused things to spiral out of control. Where the government's role comes in, you can't blame them for the number of cases rising again, because that's bound to happen. It will happen in other parts. Where you can blame them is the contact tracing has not been great. The medical facilities that were created for the mega centers, many of them were dismantled because the numbers were not there, and I guess even the government thought that maybe the numbers are not going to come again, then why waste the money? But that is now coming back to bite us, because all the ICU beds are running completely full in Mumbai and also Thane, Navi Mumbai and other areas. But if the number of beds according to the municipal commissioner is adequate, but what I am seeing is that number of beds are adequate, but the number of infrastructure on those beds is not adequate. And that's where we have a crunch. So probably there should be a renewed focus on building up that infrastructure, and it's very unfortunate that the state government is thinking along lines of lockdown as a preventive measure. It's not going to help. Even the last time around, if you remember, we were in lockdown from March in Mumbai at least up to September and beyond, and it didn't help. The numbers just kept shooting up and up.
We also took to the streets of Mumbai to find out how people think about the second wave of COVID pandemic.
While social distancing norms and hygiene practices leave room for concern, on the streets of Mumbai, people are also worried about an impending lockdown.
ये कोविड के वजह से और ये लॉकडाउन की वजह से ऐसा लगता है कि हम बॉम्बे छोड़ के चले जाएगा. या तो ना जी सकते हैं ना मर सकते हैं। और कोरोना से मरने से कम, लेकिन लॉकडाउन से ज़्यादा हम परेशान हो जाएंगे।
हम लोग देखो 1.5 महीने घर के अंदर ही थे, और जो पैसा हम लोग के पास था वो खाया पिया, फिर लास्ट में पैसा नहीं रह गया तो हम लोग अपना गांव चले गए। जब कुछ नहीं मिला यहाँ तो गांव चले गए। फिर
इस समय अकेला रह के काम धंधे बंद हो जाते हैं तो खाने पीने की भी तकलीफ होती है और अकेला घुटन महसूस होता है। राशन कार्ड पे 5 किलो चावल मिलता था, लेकिन चावल से नहीं चलने वाला है ना, उसके साथ में और सब चाहिए ना, ऐसा रहता है। काम बंद हो जाता है तो पैसे के बगैर तो कुछ मिलने वाला है नहीं। गांव में कैसे थोड़ा अनाज तो मिल जाता है, खेती रहती है, और यहाँ तो हर चीज़ खरीदना पड़ता है और जगह भी छोटी रहती है यहाँ, तो उससे और बंद कमरे में घुटन सी होती है ना। हाँ, परिवार के लिए भी यहाँ से भी चिंता रहती है, परिवार वाले भी टेंशन में रहते हैं कि चले आओ। जब ये सब बंद हो जाता है तो जा भी नहीं सकते, वहाँ वाले भी टेंशन में हो जाते हैं, यहाँ से भी टेंशन में रहते हैं। बहुत दिक्कत होती है, खाने पीने के लिए भी प्रॉब्लम हो जाते हैं ना। जो अगले साल तो कुछ थोड़ा सबके पास जमा भी था, इस साल तो अभी तक कुछ है भी नहीं, अभी काम भी अच्छे से चालू नहीं हुआ था ना, तो इसके लिए इस साल तो पैसा भी किसी के पास बैलेंस नहीं है।
तकलीफ तो हम लोगों को इतना हुआ कि हमारे ये धंधा के आधार से 10 परिवार का गुजर होता था। फिर भी साहब लॉकडाउन के हिसाब से हम लोग ने कहीं जा सके न आ सके, यही में अपना जीवन बिता रहे थे।
Adding to part of the situation is a false sense of confidence owing to the ongoing COVID vaccination, which has led to people becoming somewhat careless.
This despite the WHO experts having already warned last year that vaccines should not be seen as a magic solution to this pandemic.
Some people think that vaccine will be, in a sense, the solution, the unicorn we've all been chasing. It's not. It's a very powerful, for those of you out there who do maths, it's a very powerful term we can add to the equation of getting rid. If we want COVID to equal zero, how do we get COVID to equal zero? Adding vaccines is going to give us a huge chance. But if we add vaccines and forget the other things, COVID does not go to zero.
Given all this, it is imperative that people do cooperate and comply with the precautionary measures and do their bit in fighting this pandemic.
Remember, as Prime Minister Modi recently said,
देखिए दवाई मतलब बीमारी चली गई ऐसा नहीं। मान लीजिए किसी को जुकाम हुआ, उसने दवाई ले ली, सब ली, तो इसका मतलब ये नहीं है कि उसको ठंडी जगह पे बिना सुरक्षा के ऊनी कपड़े वगैरह पहने बिना वो चला जाए, बारिश में कहीं भीगने के लिए चला जाए। भाई ठीक है, तुमने दवाई ली है, लेकिन तुम्हें बाकी संभालना तो पड़ेगा ही पड़ेगा।
while the state administration may struggle to provide adequate health infrastructure to keep the COVID numbers under control, the people definitely cannot afford to let COVID defeat them.
Stay tuned as we bring more stories from the ground. Keep watching New India Junction. Namaste.